So I'm going to move on to the aims and objectives now. So how do smart templates work? And this will include a live demo and the importance of using templates. Before I go into the LTC template, practices will have different systems and templates available to them. So as you can see here, for example, you've got EMIS with Resource Publisher, and you currently have your LTC template active. EMIS with Template Manager, so this still will require the practices to import the templates, and these will be individual templates that we send you. And then you have SystmOne. So currently you have the individual templates, but the LTC template will be available to you soon. So we know it's confusing which template should I use. So for long-term conditions such as CVD, diabetes and local incentive schemes including asthma, COPD, cancer care reviews and QOF domains, for those practices on Resource Publisher, please use our LTC and LIS BHR CEG version 3 template. For those of you not on Resource Publisher, then please use our individual templates that were sent to you or published if you're with SystmOne. We will also be publishing some other smart templates shortly, such as women's health, which will cater for antenatal checks, postnatal checks, cervical screening, contraception. Also our child health template, which will cover child IMS, safeguarding, 6 weeks baby checks, FGM, asthma and any other areas with regards to children. And also these have been available in our other localities for quite some time, but due to practices not being on Resource Publisher, we wasn't able to offer these templates. But once they are available, we will inform you via our e-bulletin. Here is a list of the EMIS templates that are currently available to you at the moment, and SystmOne templates that are currently available to you. How do smart templates work? So they customize to each individual patient's needs using visibility rules. And what I mean when I say visibility rules is, for example, if a patient was on an asthma QOF register, we would build concepts within the template to allow only this page to show. Another example would be if a patient was on asthma, diabetes and heart failure register, then we would build the concepts for only these relevant pages to show. This is just an example of what areas the LTC template covers. And as you can see here, it does cover a lot of pages, and this is why we use the visibility rules. So you've got your AF, asthma, COPD, learning disabilities, you have the 1 stars for QOF, so CKD, dementia, epilepsy, and then you do have some generic pages that will show for every patient, such as cancer, carers details, adult IMS, ethnicity, lifestyle intervention. So I'm now going to pass you over to my colleague Tracy, who's going to go through the LTC template with you.
Hello, bear with me, I'm just sharing my screen, but it's frozen at the moment. Okay. Can you see that now?
Yes.
Yes, okay. Okay, so I'm just going to navigate through the LTC template with you. And the first thing I want to bring to your attention is along the top here. You've got your 1 star for your QOF indicators. So anything that's got the 1 star on it means it's the payment for QOF. And then you've got your 2 star indicators. So that means that's your LIS payment indicator. And as you go through the template, you'll notice that there's various 1 and 2 stars, and that will cover everything that you need to know. So as long as they're both ticked, depending what type of box they are, then you'll get paid either your QOF payments or your LIS payments. Moving on, you'll see here, so for this patient on the blue lines here, they've got the asthma register, diabetes, heart failure and mental health. So that means they are currently on those 4 QOF registers, and that will reflect on the left hand side here. So the only conditions pages that are showing up are the asthma, diabetes and mental health one here, and the heart failure comes under the CVD page there. On the CVD page, that will also cover hypertension, CHD, stroke TIA and PAD as well. So moving on to your LIS information page, this page doesn't have any visibility rules on, so you are going to see all of the current 8 LISs that you have. You'll see all of the information that's needed for payment on here. So I'll just slowly scroll down so you can see we've added in bold whether it needs to be recorded on the same day, recorded within the year. For payment, you can see you've got quality and stuff that's needed for QOF. And I'm going to stop when I get to the diabetes, because as you've been doing this for 4 to 5 years now, everybody knows exactly what they need to do for payment. You'll see you've got your 8 care processes. So all of the 8 need to be recorded within the year. That's one payment. And then the second payment would be your free target treatments. So on an individual basis, you have to make sure the BP is controlled, the statins are given, that's what the CVD risk management is, and then also the HbA1c is controlled also. And if you carry on down, you see all of the other LIS information here of what's required there. I'll briefly just show you the lab results page, as this has been in all of our templates and most clinicians know exactly what they need to do on here. We have put up the top, please see LIS information page for which blood tests are required for each service, and they do also have the stars, so the 1 or 2 stars, whichever's required. And if the patient has had their, let's say, their serum LDL done, it will show up with the date and the value, the last value that was entered. And if they haven't had any tests done, it will show no previous entries, which everybody's aware of that. I'm going to move on to the asthma page. So I'll go through this so we can see, because they was on the asthma register, that's why this page has come up. So it's using the visibility rule. You've got your QOF information up the top here. And then it moves on, so we've got your 2 stars for your high risk review. As we know, you have to have that done to get payment. And also the annual review, so the asthma annual review done. Both those boxes need to be ticked. And within that, we also have diary entries. You've got your asthma review due. So if the clinician wants to see them within a week, 3 months, 6 months, as long as they use this and then just put in the date, it will then go into the diary entry part on the patient's records. You've got a QOF star here, so number of exacerbations, I'll just put some in there, and asthma management plan. So with this, if you choose the asthma management plan agreed, once you've finished completing the template, you save the consultation, this will then open up the care plan that also needs to be created for the patient, which will open up separately. You've got your basic height, weight and BMI there as well. Then you move on to some more QOF information. So you've got asthma examination. You've got your ACT score. So this is a payment for your LIS. And the way that we've done this is if you click on the link, it will take you to the internet. Oh, sorry. There we go. And so you would go through the questions, ask the patient the questions and come back and enter the score here below. Oh, no, 25, sorry. Then you move on to spirometry, which has got QOF information on there. Keep going down, and then I just want to show you another hyperlink, which, as you know, we put the hyperlinks throughout the templates that we provide for you to give more information. So if I click on here, this one is taking me to a clinician's information. So we do them for clinicians, and then we also do them so there's information for the patient. So once the clinician is talking with the patient, they can either print the information off for them if they require it, or they can copy the link up the top here and then send it via Accurix or text message, or whichever you use in your practice. Just makes it a little bit easier for the patient, because then sometimes if you print them off information, they lose it. But if you've got the link, they can just click on it and use it from their phone, which is what everybody tends to do these days. And then carrying on, you've just got the rest of the asthma page. Again, there's more hyperlinks throughout. You've got smoking status on there. And I just want to bring to your attention here, so on the diabetes page, it also will bring up the insulin initiation and the GLP-1. So this is because they are added onto the diabetes page. So that would be why those extra pages are there. Then you've got your mental health. And then I'll just show you the CVD page as to what I meant of the hypertensions being separate. So you've got heart failure as well, but because this patient is not on pad stroke, that's why those parts aren't showing up on this page. It's only showing up the information that's correct for this patient. Then you'll notice, so from carers details down, the majority of these pages will show up on all patients. The only ones that won't will be the cervical smears. That will only show up for female patients. The admin and PCA, that page also has visibility rules on it, so will only show certain sections. So you've got carers details, accessible information, adult immunisations, and again, I just want to bring to your attention on here, we've added the COVID vaccination status on here. You can see we've added the first vaccination, second vaccination and booster. And to make it easier for the clinicians, also we've added when they're meant to be given. The second vaccination can be given 8 weeks after the first vaccination, and then the booster can be given 3 months after the second vaccination. You've got your PHQ-9 GAD7, you've got wider determinants, lifestyle intervention page, you've got ethnicity, which, as I'm sure you're all aware now, this is a national requirement. So every patient that is registered at your practice should have their ethnicity recorded. Then you've got your admin and PCAs, and as I said, this does have visibility rules on it, so we'll only bring up the sections that are needed for the patient and what registers they're on. And then lastly, you've got your treatment, over the counter and exception page. So again, this has got a lot of your QOF exceptions on there, so you can go through and just add them as necessary. So I'm going to pass you back to Billy Joe now, who's going to carry on with the webinar for you.
Thank you, Tracy. I'm just going to share my screen with you. So now I'm going to go over the importance of using templates. So the importance of using templates is consistency in data entry. So as you can see by this example, if you type in diet advice onto the consultation screen, you're going to get an option of all these codes. So it then becomes quite hard to know which is the correct national code to use. It saves time, so rather than typing in the consultation section, you can tick boxes. So for example, exercise advice, diet advice, and these boxes will have the national codes behind them. So this will be a one click rather than typing the whole word, and reduces the chance of possibly picking up an incorrect code for payment. Template allows you to see the previous entry of data. So as my colleague Tracy already mentioned, you can see here this patient on the smoking, their last smoking status was the 8th of June 2020. This is also a very good function for blood tests. So for this example, I picked the HbA1c, and again you can see this was last done on the 6th of October, and this allows you to see if it's been done in the relevant time frame. So no missing out on payment. So as my colleague mentioned already, you have the 1 star for QOF and 2 stars for Lizzie's. It follows a clinical pathway, and all that is required clinically will be in the template in line with our CEG, NICE and government guidelines. Layout of the template is designed to go with the flow of the consultation, so height, weight and then BMI, and detailed information on all of our services, so this includes LIS and QOF information. I've put this page up on here, so when you get the presentation you'll have access to our email addresses and also access to our CEG website. So there are other webinars that we've recorded previously. They will be available on this website, so please have a look around on there. We will also be sending a feedback form and we will be adding it into the chat. If you could please complete this, we would much appreciate that. So we're going to move on now to any questions.